Welcome to the Grow Your Practice podcast. Hi, I'm your host, Chad Madden, owner of Madden Physical Therapy and Breakthrough. Join me each week as we dive into the best practices, systems, principles, tips, and tricks to help you grow your private practice.
Today, we're going to talk about increasing revenue with more Medicare cuts coming. And frankly, you could talk about most insurance companies that, long-term, especially with inflation, we have some issues. And I did a little bit of math in prepping for this, but what percentage of your payer mix is Medicare?
Over in our West Ashley clinic, unfortunately, it is up to 53%. Over in our Mount Pleasant side, it's only 35%.
So a Medicare cut's significant for you?
Every time, yep. Which means our marketing nowadays is focusing on the younger group. So we're definitely trying to target on the younger group.
So wanted to go through some practice math, looking at the macroeconomy, what's going on. And I'll start with the most riveting, which is imagine that rather than a 1, 2, 3, 4% cut that we've had pretty much every year since 2008 for CMS or those of us that participate with Medicare, imagine in 1 year you had a 50% cut. Right. And I know that sounds ridiculous, but oddly, what has happened is since 1994, if you look at our reimbursement rates for the physician fee schedule from cms.gov, we're actually lower today than we were in 1994. So that's 30 years. If you do the inflation math, $1 today is 48% of the value of what it was in 1994. So oddly, that did not happen in 1 year, but it happened over the last 30 years, is that our services are worth less than half of what they were back in 1994. Anybody that's participating with Medicare, using the physician fee schedule for reimbursement, et cetera. And, the bigger problem is not that, money isn't going out. The expenditures of Medicare and of healthcare in general in the US have gone up exponentially. And I looked up 1994, healthcare expenditure in the US was $1 trillion. Today, it's up to $4.9 trillion. 1994 was $1,900 per person, or 13.4% of the GDP here in the US. Today, it's almost 20%, and it comes out to $13,594 per person, which is that's wild. So we're spending more per year today than we were almost per month in 1994. So more money's going out. Where is it going? It's not going to conservative care. So that's physical therapy, occupational therapy, speech, chiropractic care, podiatry, dentistry, optometry. It's going to others. And again, you can go to cms.gov and look at the numbers for yourself, but the majority of that's going to medications, injections, surgery, diagnostic imaging via a hospital or healthcare system. So that has gone up quite a bit in the last 20 years. If you look at any inflation chart, at the very top will be hospital and healthcare services. And I just wanted to bring in a personal story. So I have a lot of kids. My youngest son, who is now 12 years old, just turned 12, was playing on an 11U travel baseball team here a few weeks ago, and he caught a baseball with his eye. So it didn't go well. I dropped him off at practice. I was running home. Before I got home, I got a call from the coach, and he said, "Hey, Grayson just got hit in the eye. Can you come pick him up?" I said, "Absolutely." Drove out there. He got in the car. I could tell he was not doing well. So very minimal swelling or anything like that. I got him in the car. We started driving, and he said, "You need to pull over." And before I could pull over, which was immediately, started vomiting everywhere in the car. It was kind of wild. So we were on our way to urgent care. I called ahead to the urgent care and I said, "Hey, I am not a concussion specialist, but I've been around it quite a bit. He seems to have a concussion. Can I come to urgent care? What do you want me to do?" They said, "No, go to one of the hospital systems." And I said, "Listen, you're a clinician. Which one would you go to if this was your own kid?" She told me where to go to. I said, "Great." So we went there. They have a pediatric wing. I watched 5 different clinicians, whether it was a nurse, a resident, or the physician in charge of the department of the ER, come in and talk with Grayson. They did basically the 3 questions of orientation: where are you at, what day is it, what's your name. You get the idea. Wow, you can tell how far away I am from acute care. So anyhow, so we did that repeatedly, and then they said, okay, we're going to do a CT scan. We'll let that took about 6 hours. We waited in the room. And other than those 5 people coming in and just checking, we had very little done. CT scan comes back, immediately red. Within 15 minutes, it's negative. He can go home. And I said, wait. Like, negative for what? And they said negative for concussion. And I was like, there's no, he now has vomited 5 times. He absolutely has had a concussion. What are we going to do? Anyhow, we go through this whole debacle, no intervention, and outside of an anti-nausea medication. And because he was also vomiting in the room, and we got the bill for that. And I have a high deductible plan, so I get to see the EOBs and everything else. And that was $3,100. No concussion screen ever done. And it was absolutely wild. So just realize that, our healthcare system within the US is very expensive. And if we look at any of the major statistics around chronic disease or anything like that, we're not in the top 20. So it's almost twice of that of any other country. And we're flowing very little money to conservative care in general. We have very expensive reactive medicine. And then now we're faced with more cuts. Our costs to provide care are going up. And what do? I'm in the same boat as you, John. Most of our offices are bordering around 50% in terms of federal payers. I put together what the screen looks like. We have a flywheel, and the flywheel is step number 1 is audit. So we want to be able to look at what's going on. The second one is we want to be able to create a plan based on the proposed cuts and anything else that might happen, so we can create some contingency plans and better strategize. Step number 3 is strategize. Step number 4 is implement. 5 is measure. 6 is we want to update and repeat this every 90 days. And so in my own private practice, this is what we do with our clinical directors and our leadership team, and we do it every 90 days. So we go through this similar process. So if we're having a Medicare cut and we're auditing, audit means we want to look. So we're going to find out, what percentage of our payer mix is Medicare. How much is this going to affect us? And we use, again, federal payers. You have to include any insurance company that is basing your reimbursements off of the physician fee schedule. So that's step number 1. Step number 2 is we want to look forward. We want to plan and see how this is going to affect us. So I'm just going to use a hypothetical practice here. Let's say a practice is doing $1 million a year in revenue, and 50% of the payer mix for that practice is Medicare. And let's say there's going to be a 4% cut. And I know I stopped paying attention a little bit to the exact numbers. I know it usually comes in between a 3 and 4% is the proposal. And then in the end, by the time we get to January 1 or January 15th or whenever they amend it, it's usually like a 1.5 to 2%, right? So let's just say 50% of the practice, $1 million practice, is Medicare or uses the physician fee schedule. And let's say the proposed cut is 3%. How would we project forward how this is going to affect the practice? Well, if our projection for next year, 2025, is that we're going to see $1 million and that half of those patients have Medicare and the proposed cut is 3%, that means on $500,000 of that revenue, roughly speaking, we're going to be taking a 3% cut, which happens to be $15K. So really our revenue next year isn't going to be $1 million. If everything stays the same, it's going to be $985,000. And the issue is that, let's say we have a 10% margin in that practice, 10% profit margin. So now we have $100,000 in annual profit. Now that becomes $85,000 just with that seemingly small cut of 3%. So we have a tool, it's called the Profit Planner. It's a 12-month projection. Honestly, at minimum, as a practice owner, if you're listening to this, you should be projecting at least the next 12 months. We run a projection for the next 10 years. So we have, back in 2017, we wrote one through 2030, and then we have finer detail in the 3-year and 1-year plans. But yeah, so you should be looking forward, forecasting forward how this is going to affect you. And then the next thing that you want to do is you want to be able to strategize. So I know, John, the one thing you said is, be able to attract a younger population of people. I think that's a very viable strategy. In the Profitability Under Pressure course, we talk about 4 profit levers. The first one is marketing for profit. That's primarily filling up underutilized space and filling up underutilized schedules for the clinicians. The second one is increasing lifetime patient value, and that's primarily patients returning for additional care, patients referring other patients, and then adding additional services for things that they're already paying for or complement the care, like laser, like we now have hyperbaric oxygen therapy and other amendments, add-ons to the plan of care. We can improve the payer mix. And in terms of exactly what you're talking about there, that's the most basic way to improve the payer mix is to attract a younger population of people. I'll give one example there. We just now had our second pelvic floor workshop, and I'll give you a little bit of the history. So at Breakthrough, we do essentially three things for practices. One is we do information, right? So I teach a course a few times a year with other guest instructors. Our active course right now is Profitability Under Pressure, but we've done Killer Marketing, 24 Months to All-Star, Max Value, and quite a few other, the Patient Demand course, quite a few other courses over the years. We also do have software, which is a CRM, helping owners run all of their marketing in one location for their current patients, everything from current patients to cold traffic, using text, email, and partners, online ad campaigns, etc. So that's an all-in-one software solution. And then the third thing that we do is we run ads. Well, one of the most requested ad types, and we do it primarily for diagnosis. Per diagnosis, one of the most popular requests, common requests, has been pelvic floor. And so for years, I was very hesitant to put time and effort in there because we had experience as a practice. For 7 or 8 years, we had a pelvic floor program. And it was, I'll call it break even at best. We had an amazing clinician, Mary Ann Gingrich, who has since retired, and we tried to replace her, and there were just no clinicians that we could find who wanted to specialize in pelvic floor. There were only 2 or 3 in the entire central Pennsylvania area at the time, and I mean, we're talking a population of 800,000 to 1 million people. So now it seems many of the new grads that we're talking with want to treat pelvic floor. Currently, we have 2 therapists who wanted to do it. We had many other requests from owners at Breakthrough that we're running ads for to build out this pelvic floor program. And we did a lot of surveys. And in the end, we decided on the first pelvic floor niche that we were going to target is new and expecting mothers. And the incident rate of pelvic floor and low back issues in that population is very high. Some research has it at 50%. And in general, we're not competing with the hospital system for the care there, because traditionally the healthcare system that we're competing with for those healthcare dollars, they're not going to provide medications for that. They're not going to do injections. They're not going to do surgery. And they'll typically say, well, this is just a normal part of pregnancy, but they don't have a treatment solution that we're competing with. So we tested this out. It is the initial results of running it here and then 5 other beta practices within Breakthrough. And now we've just opened it up more, but it's the best performing ad spend we've ever seen. So cost per lead, the lead is more responsive, and there's a little bit of, I have to eat some crow here because I should know better. I should have known better. So I was very resistant to this for years.
Before we continue with this episode, here's a word about our course, Profitability Under Pressure.
What are the 4 ways practice owners are increasing their revenue per visit in today's market? Chad Madden here, introducing you to the Profitability Under Pressure program. This is a 90-day masterclass designed to help you build a financial system in your private practice to improve your revenue per visit and your bottom line profit margin. Many practice owners like you are facing declining reimbursements and increasing operational expenses. It's more expensive to provide care. This makes it harder to maintain the financial health of the practice. The Profitability Under Pressure program compiles the processes working for practice owners today into one system to help you increase profit margins, regain your time, and help more people in your community. With our program, you'll learn how to conduct a profit leak audit, how to create a plan for profit, and how to use the 4 profit levers to increase your revenue. Plus, you'll enjoy a complimentary 90-day trial of our patient demand software and access to our exclusive Insider Circle community. Don't just take my word for it. Hear from practice owners like Lance Gross, who added $1.1 million to his bottom line, and Peg Ray, who got her finances under control after 4 decades in practice, or Jeff Gersh, who saved time by getting the cheat sheet to increase profitability. Don't let this opportunity slip through your fingers. Apply today for the Profitability Under Pressure program and start increasing your profits by $10,000 or more in just 90 days. Click the link below to join the waitlist now. Secure a more stable financial future for your practice. Apply now and join the ranks of successful PT practice owners who have transformed their businesses with our program. Make sure you apply before the General Admission Scholarship deadline on August 31st. Apply today.
Thank you for listening this far. Now back to the episode.
In the end, I mean, our last workshop, we had 55 registrants. We had 20 plus people attend. And by the way, not only did we get new and expecting mothers, but we had other demographics as well, because we're talking about pelvic floor issues, even though we're targeting that population in the ads. So this is not the Medicare population, right? This is not the pelvic floor for prostate that tends to skew older. Although, I mean, we're not excluding them in our advertising. We're just highly focused on pelvic floor for new and expecting mothers. So, and they're very responsive. So they're used to attending appointments. They're used to investing in conservative care, and they're called the golden goose of retail. And I'm going to get off on a little tangent here. But if you're looking to improve your payer mix and you want to target a population of people, expecting mothers are called the golden goose of retail, and here's why. Once they have a child or two and they begin a family, whatever they're doing at the time, if they're going to Target, they're always going to go to Target, right? So, and there's a famous story on this. Charles Duhigg wrote a book called Habit. And in that book, he tells about in the early 2000s, Target hired data scientists, and the one group they figured out working for Target, they figured out that an expecting mother who hasn't even told like her partner or boyfriend or husband yet that she's pregnant, she will go buy 4 things from Target. And I completely forget what all 4 were, but I believe it's unscented lotion, neonatal vitamins, or a multivitamin for herself specific to pregnancy. There's washcloths, and I think the other one is cotton swabs or something like that. So she'll buy those 4 things. And what was happening is Target figured out that when a woman would come through and she would buy those things, that she was likely in her first trimester, and she just figured out that she was pregnant. Well, then what they would do is the coupon clipper that they would send to her house became 100% cribs and diapers and everything else. And they figured that if they could get her to buy diapers from Target and change her buying habits, her buying behaviors, then that she would be in the habit once the children came, that she would continue to buy from Target forever. And it's fairly true. The issue was in the book, Charles writes about this story where I believe it was in Minnesota. There was an 18-year-old girl who was pregnant who received the Target flyer. She hadn't told anybody, and her father was like the superintendent of this local school district, and he went into the local Target, and was furious. And the store manager had no idea what marketing had figured out, and this was all automated. The point being is that you can, based on your own marketing, whether it's to your own patient list or cold traffic marketing, with strategy, you can improve your payer mix. In general, we want to attract more of our higher payers, less of our lower payers, and the other option there is we can renegotiate. And then the final thing here is strategic coding. So that is, taking a look at, for example, New York, 10, 15 years ago, when they were decimated with their reimbursement rates, overnight, most private practices that I know had to go from a 1-hour treatment slot or 45 minutes and reduce that to 20 or 30 minutes. It was the only way they were going to survive, because their hourly rate just went too low. They were going to go out of practice, and many did. So, and there's some other things that we can talk about in strategic coding, but none that really apply to Medicare outside of group therapy and the use of Therex and everything else that Mary DeLong usually talks about here at Breakthrough. So that's the strategy. And then what we want to do is we want to take whatever one of those 10 or 12 strategies I just mentioned, we want to pick one or two that are best going to move the needle for us into the next year, and then plug that into the profit planner. Then we implement those strategies. Then we measure the results of that throughout the year. And again, every quarter, we're going back to that and saying like, okay, we opened up the pelvic floor workshop now, and we wanted to attract a younger population of people. How is that working? Right. So we evaluate it and then adjust accordingly and go through. Oddly, if you're able to see the 6 steps right now, this is probably what you're doing in patient care, right? You're going through, you're auditing, that's your objective measures, your history, et cetera. You're creating a treatment plan. You have treatment strategies that are within that treatment plan. You're implementing, you're executing on the plan of care. You're measuring the results throughout, doing a progress note, discharge note, et cetera. And you're updating and repeating likely more often than every 90 days for the patient, probably once a week, once every other week, once every 30 days, things along those lines. All right. That's how I would think through it. So whether I'm talking with an owner one-on-one, or we're in the course, or, this is my own private practice, this is the exact 6 steps that we're following. Any questions that you have around Medicare cuts and how to think through?
Nope. I mean, that's helpful. I mean, to have the plan and see the cycle kind of keeps me a little more organized. So I appreciate that.
The other thing that I want to comment on, and I've reached out to the heads of the different associations, and I just want to talk for a second about what I see happening in private practice, in particular PT, is anytime that we have that increased pressure, which is exactly what a reimbursement cut is, we can start to be very polarized about what that solution looks like. I see a lot of my friends that are private practice owners who I respect, admire, and they will get very fixated that this issue is not their issue, and that like somebody else has to solve it, whether that be government. And I'm not going to get into politics here. I'll never do that on this platform or pretty much anywhere in my life. I'll leave it at that. So whether it's political or, the government somehow needs to change this. Yes, we're talking about a federal payer and a cut in reimbursement from a federal payer, but that is probably going to happen no matter what. I don't see it reversing. From 2008 through today, that physician fee schedule that determines what our services are worth for those of us that are participating with Medicare, that is down 15%. And it's fairly consistent. I mean, we're going to continue to lose 1% a year or more. And I really think that's our responsibility, right? It's our responsibility to go out and educate the most. And again, I have an unfair position, but it's very easy to blame, right? It's easy to blame the Fed, who's creating the inflation. It's easy to blame government. It's easy to blame the competition within the healthcare systems, and they're not helping. Yet at the same time, there's a CEO of that healthcare system that has stockholders that he has a fiduciary responsibility to. The same thing with insurance companies. They have a fiduciary responsibility, and really the only way that they can improve their profit margin is by increasing the amount of premiums they're charging, which the only way they can legally do that is by actually paying out more. And you and I are likely a threat to that for them. We really need to understand that rather than rely on those entities to save us. I see a large contingency thinking that, it's more advocacy, or we're not lobbying the right way, or we don't have enough money there, or something like that. It is going to be very difficult for us to compete with some of the larger entities as an industry when their lobbying budgets are essentially what our entire revenue for our industry is. Like, they're not, it would be, I think it's the wrong strategy to play their game, because we're in a David versus Goliath issue. However, there is a ton that we can control internally, right? And I think more about implementing the right strategy for our unique practice is a better bet than some sort of huge advocacy effort on behalf of private practice. I'm not seeing it. The other thing that I'll say is, only from experience, we had incident here in Harrisburg, where the state capital, and we happened to treat a legislator who was involved in, I think it was around access to physical therapy. It was something around direct access, and that helped tremendously. So I think that is a much better pathway for us, is to having patients be advocates for us. If they happen to be legislators, if they happen to be lawmakers or anything along those lines, then more power to us. That's really the only effective change that I've seen happen, whether it be Louisiana or with any other group that has successfully renegotiated higher rates or anything else. It's really the patients that are being advocates and pushing the change through, whether it's the insurance company, whether it's the healthcare system or the government. That's the only way we're going to win in the end. Other than that, hopefully this was helpful for everybody. Thanks, everybody, and I'll see you next week. Take care.
Thank you. Appreciate it.
What are the 4 ways practice owners are increasing their revenue per visit in today's market? Chad Madden here, introducing you to the Profitability Under Pressure program. This is a 90-day masterclass designed to help you build a financial system in your private practice to improve your revenue per visit and your bottom line profit margin. Many practice owners like you are facing declining reimbursements and increasing operational expenses. It's more expensive to provide care. This makes it harder to maintain the financial health of the practice. The Profitability Under Pressure program compiles the processes working for practice owners today into one system to help you increase profit margins, regain your time, and help more people in your community. With our program, you'll learn how to conduct a profit leak audit, how to create a plan for profit, and how to use the 4 profit levers to increase your revenue. Plus, you'll enjoy a complimentary 90-day trial of our patient demand software and access to our exclusive Insider Circle community. Don't just take my word for it. Hear from practice owners like Lance Gross, who added $1.1 million to his bottom line, and Peg Gray, who got her finances under control after 4 decades in practice, or Jeff Gersh, who saved time by getting the cheat sheet to increase profitability. Don't let this opportunity slip through your fingers. Apply today for the Profitability Under Pressure program and start increasing your profits by $10,000 or more in just 90 days. Click the link below to join the waitlist now. Secure a more stable financial future for your practice. Apply now and join the ranks of successful PT practice owners who have transformed their businesses with our program. Make sure you apply before the General Admission Scholarship deadline on August 31st. Apply today.